Hello everyone. Today we'll be talking about ECG changes in right atrial enlargement. Right atrial enlargement is defined as presence of peaked P waves with amplitudes in lead 2 of more than 0.25 millivolts. So what do you mean by 0.25 millivolts is 1 millimeter. 1 millimeter is equivalent to 0.1 millivolts. So this means that if the peak P waves amplitude is more than 2.5 millimeters in lead 2, then it is called as right atrial enlargement. So as you can see here, this is a lead 2, which is an ideal lead to study about the P waves, and also lead V1, because in lead V1 what happens is there is biphasic pattern. So P wave is biphasic. That is, the initial part is because of the right atrial depolarization, and the second half is because of the left atrial depolarization. So what happens is, because the right atrium is very much enlarged, so right atrium will take more time, and it will take more contraction will be there. There will be more depolarization. So that's why the height of the P wave is increased. But the second half is formed because of the left atrium. Since there is no left atrial enlargement, the duration will not change. So this part of the second half is remaining same. So duration remains same, but the height increases to more than 2.5 millimeters or more than 0.25 millivolts. So that is suggestive of what is called as right atrial enlargement. So more than 2.5 millimeters in the inferior leads. So in ECG wise, if you calculate, is each small square is 1 millimeter. So if you take a small each, this is a whole large square, and each small square is 1 millimeter. If the show height of more than 2.5, you can see here more than 2.5 small square. If it is there, then it is suggestive of right atrial enlargement. Other thing is, if you are taking lead V1, since it is biphasic, as I said already, the first half is formed by the P wave, that is the right atrium. The second half of the P wave is because left atrium. So if there is a height of this P wave, the first half of the P wave, if it is more than 1.5 millimeters, that is more than 1.1 small squares, then it is called as right atrial enlargement. So what are the causes of right atrial enlargement? Is primarily due to pulmonary hypertension and chronic lung disease, tricuspid stenosis, congenital heart disease, and primary pulmonary hypertension. So, what are the mechanism which is responsible? As I've already said you, the mechanism which is causing this changes ECG abnormalities in the right atrial mass is because the greater RA mass. Since right atrial is more enlarged, more greater RA mass, and it generates more electrical forces and thus producing taller P waves. So because RA activation occurs early during the P wave duration is not prolonged. So if duration has to be prolonged, it is mainly dependent upon the left atrial enlargement. So you can see here, as you can see here, there is a tall P waves in lead 2.